I'm doing some of these videos just to address some of the common questions that are coming through to us in the clinic over the last couple of weeks. Neck pain is a huge one, right? Everybody's working from home. Working from home is painful. That seems to be the slogan of the month. And a lot of times, here's what we hear. Hey doc, it just popped up. It just started hurting. I didn't do anything. I didn't do anything out of the ordinary. I'm not sure why this happened. So let's go ahead and talk about one of the causes, all right? Almost everybody watching this video is gonna know who I am, all right? You're under my care. But in case you share this video with somebody else, my name is Nick Manteris. I'm the treating doc at Broomfield Spine and Injury. I love what I do, and I want my patients to get better faster. So let's take a look at this, all right? The number one cause of chronic spine pain anywhere ever is ligament damage. That's the simple answer, right? So I don't know if this is a great model or not, but the bones in the spine are held together with ligaments. There's actually 10 ligaments that cross each joint, all right? The disc is one of those 10. It's actually considered a ligament, all right? And you obviously don't see the other 9 here, right? They're just too complicated to put on the models. So when I tell people chronic pain is because you've got ligament damage in the spine, and that means that it is not stable the way it should be. And kind of the big phrase is abnormal loading. And people go, it's confusing. No, it's not. If you stack blocks on top of each other, right, and they're all straight, the weight is distributed equally on all 4 corners. But if you take one block and you shift it halfway over on the other block, right, you've got more weight on one side than on the other. It's abnormal loading, okay? Well, in the spine, the nervous system knows that, right? It's got all these receptors that tell the brain and spinal cord where this stuff is at. Like, where are they? Oh, they're shifted. They're not moving correctly. There's more pressure on one side than the other. And in order to get some sense of stability, some form of stability, the nervous system actually just lays down more bone, right? And again, I don't know if this is a good model or not, but you can see where this bone is lipping out, right? It's making the base bigger, right? A bigger base means something is going to be more stable. Incidentally, the mechanism is called Wolff's Law. It's been around a long time. Physiologically, everybody knows it's a law, right? So that's arthritis, by the way. That's degeneration, right? Degeneration and arthritis. That's a lot of docs are calling this degenerative disc disease. I would take issue with that, but that's what they're calling it. Abnormal loading. Doc, I didn't have any ligament damage. Really? How many times did you fall off your bike when you were 7? When we were 15? Fender benders that we don't remember? How many sports in high school? We take traumatic blows all through our life. The problem is we're relating damage with pain, and that is just not what happened. Very small percentage of the nervous system reports symptoms of pain, okay? If we felt all the pain that life had to give us, we wouldn't get out of the bed. I mean, there's a lot of pain in this world, right? Gravity is a bear, right? And it never stops. It will always win, right? So we get all these bumps and falls, and the pain is there for a minute, and then it goes away, and we think, oh, I'm fixed. You're not fixed. The trauma to the ligaments is there. And when ligaments get injured, they get stretched. They never go back to where they used to be. That's super important. Ligaments, if I roll an ankle, if I sprain an ankle, those ligaments stretch out. They're never going to go back to where they were. They're going to wound heal just like skin does, where it gets some scar tissue. But it's not going to support that ankle the way it used to. Same thing with the spine, all right? So whether it's neck pain, low back pain, anything in the spine, number one cause of chronic pain is ligament damage. Can we determine the location and severity of that ligament damage? How many of you have come into this clinic from other chiros, and I'm not bagging on other chiros, I'm just not, and I ask you, great, what was your diagnosis? I don't know. That's crazy. We should know specifically what is wrong with you, right? So we can fix it. Here's the second thing. Matter has limitation. Some conditions can only be managed. Super, super important concept for my younger patients in here. You guys, you know I love you. You're snowboarding, you're doing active things, it's great. every time you catch air and you pack, right, and you get mild whiplash, you're affecting these ligaments. They don't go back to where they were, right? If I'd have known that when I was doing that, it may have changed what I was doing, maybe not, right? But it may have, all right? And so what we just need to remember is this: once we've got enough damage on these for my older patients, right, my age, we may not be able to fix this all the way. We may only be able to manage it, okay? Most complicated structure in the body is the spine. Those of you that are under my care, you're actually thinking about maintaining this. If we want some level of health for anything in life on earth, it takes maintenance. Right now, the paint on your house is wearing out. Your tires are wearing out. Everything we own under gravity that is subjected to friction is wearing out. But I guarantee you, if you ask somebody who's not under care here or with another chiro and you say, what are you doing to maintain your spine? They're going to look at you like you're an idiot, right? But if you ask them if they change the oil in their car, they're going to look at you like, why would you even ask me that? Of course I do, right? We maintain these things. So look, that's just a kind of an intro into ligament damage, chronic pain, how we can deal with it by knowing exactly where the location and severity of that injury is, and can it be fixed, or do we have to manage it over time? I appreciate you taking the time.